This is Miranda with Dr. Allan Jaffe, professor of medicine from the Mayo Clinic. Hi, Dr. Jaffe. Always a pleasure to see you. Can you give us your opinion on the results of one of the late-breaking trials yesterday, looking at troponins in the ER for ruling out myocardial infarction?
Yeah, I think that it's going to turn out that having an undetectable or a very low level of high-sensitivity troponins will work to exclude acute myocardial infarction in most patients who present in the emergency room. And the reason for that is not going to be because it detects a rising pattern due to injury, but likely because these values won't be very low if you have the risk factors that might lead to the development of atherosclerotic disease, such as hypertension or LVH or heart failure or renal disease or diabetes. All of those elevate the high sensitivity troponin values. So the technique likely will work. I had a problem with the paper yesterday because the criteria which they used for ruling out myocardial infarction were not stated. They did not review the cases where it was ruled out, so the possibility that more cases might have been included had they really reviewed their data in a more comprehensive way couldn't be excluded. So I do think this will work, but I think we have to be careful and make sure that all the I's are dotted and all the T's crossed before we start doing this clinically.
So you're saying that we're now more confused than we were?
Well, I don't think there's any way for you guys to be any more confused than you already were, but I think that the strategy will likely work. The data and, again, the structure of studies needs to be done in a highly credible and scientific manner, and I thought that was lacking in yesterday's presentation.